We have another virus we call cytomegalovirus. This cytomegalovirus, it causes what we call cytomegalic inclusion body disease in the infants. So, if I were you, is more importantly here is just to know that this cytomegalovirus is a virus that is common in infants, causing what we call cytomegalic inclusions. Um, it also causes what we call mononucleosis in transfusion recipients when you do blood transfusion. It can also cause pneumonia and hepatitis in immunocompromised patients. Okay, so we are talking about infants and then immunocompromised patients, especially pneumonia and hepatitis. This is okay, again an enveloped virus with the cuboidal appearance, double stranded. In terms of transmission, this virus is found in many human body fluids, including it can be in the blood, it can be in saliva, it can be in semen, it can be cervical mucus, it can be breast milk, and even urine. So you see, if all these fluids from our body can have that, then that is the very reason to tell us that you can get infection through blood transfusion, or when you become in contact with the blood of somebody who is having the virus, you can get infected through saliva contact, be it kissing or just whichever the case. You can get infection through sexual intercourse because the semen plus the cervical mucus, that again you can get that cytomegalovirus. Also, for the infants during breastfeeding, they can again get that. So, if these fluids transmit this virus, and then also we are saying, therefore, across the placenta or by organ transplantation, becomes also a source of infection. So, once you are infected, how does it start? Initial infection starts from the oropharynx, you know, they become infected, and for fetal infections, those not yet born infants, the virus will spread to many organs, e.g., the central nervous system, the kidneys, once you're growing up. And in adults, it can still affect lymphocytes. And you know very well, lymphocytes play a major role in terms of being defense cell, a white blood cell. So the latent stage occurs in the leukocytes. They get hidden or embedded inside the white blood cells, and then they spread um, in immunocompromised patients, can be as a result of either primary infection or reactivation of the latent infection. Yeah, you take note of the word latent. It is very common in this setup because you can either get infected afresh, or maybe you got an infection some time back, but the virus did not completely clear from the system, and therefore you are bound to, you know, to make it activate it. Then it causes a new infection through the activation. So that's how we can get infection of this cytomegalovirus, you know, and then how it can present and areas it can affect. So how do we can we diagnose it? Through viral culture, the cells. You can also do uh, antibody check if they are there against the virus. We can treat using what you call Cangicolovir is a drug that is now uh, recommended. This is an antiretroviral drug which benefits in treating pneumonia and rhinitis. Once this virus goes and affects the lungs and you know, the sinus and all that, and and the renal system, this drug is much more effective.